Hi everyone. Today I'll be discussing about malignant diseases of the jaws. To introduce the topic, malignant tumor represents an uncontrolled growth of tissue. Unlike benign neoplasm, they are more locally invasive, have a greater degree of cellular anaplasia, and have the ability to metastasize regionally to lymph nodes or distantly to other sites. Malignant tumors. They are mainly classified into two types based on the origin. Primary tumor that arise de novo. The secondary tumor are metastatic malignancy, those that originate from the distant primary tumors. Cancers may be caused by viruses, significant radiation exposure, genetic defect, or exposure to carcinogenic chemicals. The malignant diseases of the jaws are mainly divided into four categories. Carcinomas, those arise from epithelial tissue, metastatic lesions from distant sites, sarcomas, lesions arising from mesenchyma, and malignancies of the hematopoietic system. Out of these four categories, carcinomas are by far most commonly encountered in dental practices. Coming to the general clinical features, so these are the signs and symptoms thus suggest that the lesion in the jaw may be a malignant lesion, like displaced teeth, loosened teeth over a short time, foul smell, ulceration, presence of an indurated or rolled border, exposure of bone, lymphadenopathy, weight loss, dysgeusia, dysphagia, hemorrhage, lack of ear healing after oral surgery, and pain or rapid swelling with no demonstrative dental causes. The most of these oral cancers occur in the men aged above 50 years. However, it can occur in older age group and it can affect any of the gender. The dentist must watch vigilantly for the possibility of malignance in their patients. The risk of lack of attention to these possibilities are delayed diagnosis, delay in the treatment, increased need for aggressive treatment with added morbidity, and in the worst cases, premature death. So coming to the radiographic examination, being a radiologist, why it is important, how the radiographs helpful in the diagnosis and treatment of the oral cancers. The first and foremost is the diagnostic image always aid in the initial diagnosis of a tumor, and it also helpful in appropriate staging of the disease from early small cancers to large cancers that are spread. Appropriated radiological investigation will assist the surgeon or a radiation oncologist to determine the anatomic spread of the tumor so that it can be excised or irradiated adequately. The radiological investigations has the potential to determine the presence of bone involvement from the soft tissue tumors and help the practitioner to assess the involvement of lymph nodes and treatment outcome. Finally, a thorough radiographic examination is play a very important role in management of cancer survival, who often is rendered xerostomach, neutropenic, and susceptible to dental caries, periodontal disease, and systemic infections. There are various different imaging modalities are available to aid in the diagnosis of oral cancer. First and foremost, we should always start with the basic radiograph, that is intraoral radiograph, which can provide the best image resolution and able to reveal subtle malignant changes like irregular widening of the periodontal ligament space. The panoramic radiograph is the second ideal radiograph which helpful in the overall assessment of the maxillofacial osseous structures and can reveal the relevant changes like destruction of boundaries of the maxillary sinus. And the third and important diagnostic aid is cone beam computed tomography or medical CT images, which provide a three-dimensional analysis of osseous structure and better to determine the position and extent of the tumor. Nowadays, one advanced imaging technique, that is PET, positron emission tomographic scan. It is capable of detecting abnormal cellular metabolic activity associated with malignant tumors, and it always fused with CT images to provide an accurate location of the tumor in preparation for radiotherapy. The final diagnostic aid is MRI, which provide a three-dimensional soft tissue images of the tumors and information regarding perineural spread and involvement of the limb.